So now we're going to go with sputum production. In this sputum production, it is an tracheobronchial secretion. So this is a tracheobronchial secretion, contains saliva, microbes, cellular debris, mucus, okay, many things. So we're going to classify this sputum into amount, color, consistency, postural as well as diurnal variations that we see in asthma, and the smell, what we call technically odor. Okay, for a normal person, there will be a production of normal sputum that is of 10 to 15 ml. Okay, so if we draw the diagram of a lungs, that where this sputum will be produced by which mechanism. Okay, so see, these are the lungs. Okay, so there will be number of goblet cells, here. Okay, that the goblet cells also available in the alveoli. See, this alveoli also contains goblet cells, and these some of the cells in the tracheobronchial. The bronchial also contains the goblet cells. So here is the goblet cells. The goblet cells will be like this on the epithelium. So based on amount, see, can we say this as ACCPO? Okay, ACC cement. Okay. So what is the thing here? Here we'll be dividing this by amount. So amount is divided into less than 2 spoon. You can say 2 teaspoon. Yeah, scanty. Okay, and half a cup moderate container. Take as glass 100 ml. So here scanty is 2 to 5 ml. Here is less than 50 ml, and here is greater than or equal to 100 ml. Okay, remember, it is 2 to 5 ml. This is 50 ml, and this is greater than 100 ml. Okay. Here, what happens here? So in this 2 to 5 ml, that will be in a bronchitis. Okay, and here TB. Okay, tracheobronchial tree, alpha, or pneumonia. Okay, in the pneumonia, you can suspect that if the person is coming with less than 50 ml of this one, then you can suspect it as a pneumonia. And greater than 100 ml, that is bronchiectasis. You know the pathology as you read in the theory. It will be something like saccular, fusiform, the different types of bronchiectasis where they lose the epithelium thing and elasticity. So here the bronchiectasis where it will be foul smelling and lung abscess. So foul smelling. Okay, this is small foul smelling. So next we'll go to the sputum production. That is, normally a person that is 10 to 15 ml previously, I said like sputum production, that will be normal around normal sputum production is around 20 to 30 ml, or you can say Sometimes we get a situation where there will be a sudden onset of the purulent, like ತುಂಬ ಜಾಸ್ತಿ ಬಂದ್ಬಿಡೋದು ಕಫ. Sudden onset of an greater than 100 ml of a sputum coming outside. Okay, if you take this as a lungs and okay, sorry, sudden, if there is a lung abscess here, if it ruptures in the bronchial tree, lung abscess, if it is ruptured sudden in the bronchial tree, then it will be a sudden onset of the greater than 100 ml of the cough, a sudden onset of the sputum, it will be coming outside. Okay, and what about this large watery sputum that is with pink tinge? If we are thinking it as pink tinge, then we could suspect it as something like blood. Okay, that is in acute breathlessness patient over weeks continuously. If there is a pink froth tinged sputum, then we could suspect it as an alveolar cell carcinoma, suggestive of pulmonary edema. This is acute. Okay, bronchoria. So what do you mean by bronchoria here? So bronchoria, it means like greater than 100 ml of sputum is produced per day. That will be in bronchiectasis. Second one is in lung abscess, and third one is in emphysema. And fourth one is cystic fibrosis. Cystic fibrosis, you might be knowing a very good mechanism of the CFTR gene, which is on the interlumen side, which does not allow the chloride inside, so the sodium stability will be reduced and there will be a formation of sodium chloride crystals outside that one. So based on the color, if you're saying based on the color, clear and mucoid, that we could suspect chronic bronchitis, COPD, with no infection. So if there is an infection, then we could suspect with yellow. So yellow, then it will be a bacterial infection. So remember, bacterial infection. Acute lower respiratory tract infection, asthma, eosinophilia. If you're taking it as a green, then we could go with chronic infection. And COPD and bronchiectasis. I could say dead neutrophils. Yep. If you see there's a pink one, then you could go with pulmonary edema. Okay, And if you say the black thing, then you could go with pneumoconiasis. Testosterone. Then if you're seeing rusted red, then you could go with pneumococcal pneumonia. Red currant jelly. Then you could go with Klebsiella. Anchovy sauce. Anchovy sauce, that would go to liver abscess rupture. Okay, that we completed amount and color. Next we are going to consistency. Okay, consistency, if you're seeing that, then it will be serous, mucoid, purulent, postural variation. Okay, in the purulent, we'll go with the serous, we'll go with acute pulmonary edema, alveolar cell carcinoma. And the mucoid will go with COPD as well as asthma. In the purulent, we'll go with suppurative lung disease with bacterial infection. And the postural variation will go with lung abscess. So I completed with the consistence, color as well as this one. So now we'll go with odor. Foul smelling. In the foul smelling, we will take it as bronchiectasis, lung abscess, empyema, anaerobic bacterial infection. Okay, and there will be a solid material in sputum. Okay, that will be found in asthma, allergic bronchopulmonary aspergillosis, the Crusherman spirals, like that of things. Okay, this is the end of types of the curve, amount. Okay, that is amount, color, consistency, and the order. Okay, postural or diurnal variation, as I already said about this one, lung abscess. Okay, thank you.